Struggling with itchy skin? You are not alone. Hi, I'm Louise, certified clinical aromatherapist and your self-love coach. Today, we are honored to have Dr. Neogh in our Kindness Show. Hi, Dr. Neogh.
Hello.
Dr. Neogh is a medical doctor specializing in skin and hormone wellness. He has over 15 years of experience helping women and men restore hormone balance and optimize daily performance. Today, we will explore and discuss topic related to sensitive skin and eczema. Stay tuned. Yes, Dr. Neogh, because in our customer base, day-to-day basis, we see a lot of customer with eczema. So in your 15 years of practice, how often do you see skin allergies in your clinic?
Yeah, in my practice, I almost see skin allergy every day. It's so common. Every day I see more than 10. Because skin allergy is very common among our population. Although some studies they have shown that about 10% of our population is having a skin eczema. But I would say everyone will have some form of skin allergy in their lifetime. It can be simple allergy in response to certain allergens, or it can be as bad as skin eczema.
What do you think is the factors that is causing the eczema?
Yeah, I would say because our environments plays a very important factors. We have a lot of pollutants around us. For example, things like nickels in jewelry, or sometimes we have a lot of construction around our housing area, then there will be more dust and the pollens. And even sometimes animal, pets and insects can also trigger a skin allergy. And also another thing is when people's lifestyle is also play a very important factors. Our lifestyle also determine our immune system. So people sometimes they don't have a very balanced nutrition diet, and then they sleep late, they are stressful. All this can contribute to allergy problems.
So these are related to lifestyles or what they get in touch, in contact with in a day-to-day basis, like dust and all that, right?
Yes.
Now that we understand the factors that's causing eczema, but the dry skin also prone to eczema?
Yes, there are three things happening in eczema. Number one is our skin is like a barrier to protect us from the allergens outside the world. So imagine this is the skin. So when your skin is dry, then the skin tends to crack. Then the barrier it has lost the protecting ability. And the second thing happening is the allergens like dust, chemicals. Then they can enter our body through the cracked skin. After that, this allergen in our body will trigger the immune response, and the immune response will create the inflammation, and that is how causing this eczema. People with drier skin, then they tend to have more cracked skin, more allergen to enter the body, more immune response. One of the most important way to prevent eczema or in treatment of eczema is to restore the skin barrier.
When it comes to food, oftentimes we hear that people with eczema, they always avoid certain type of food. Does it cause eczema as well?
Food can certainly trigger skin eczema, sometimes skin allergy. But food actually is not the cause of the eczema. It's actually the chronic inflammation in the skin, and that is triggered by the food. But the cause is the immune response. So certain food, if you know you are allergic to certain food, or if you know certain food can trigger your skin rash or skin eczema, then you will need to avoid that food.
How do we find out what kind of food or what allergens that we allergic to?
We can sometimes do a test. It's an allergy test. It's a blood test. Then we can identify, see what you are allergic to. But a lot of times, this eczema flare-ups not necessarily triggered by food. Sometimes when you are stressful, then you become your immune system become imbalanced, or sometimes you have a drier skin, then it becomes sensitive. It can also trigger eczema. So a lot of times eczema has to be triggered by food or by allergen.
What about families? Does it run in the family?
Eczema do runs in family. Certain genes, it can make someone's skin drier, then they tend to have more cracks, so they are more prone for eczema. And certain genes also can make your immune system hyper-responsive, which means sometimes a little bit of allergen that can cause a very bad immune response and leading to skin inflammation, and then they will get the eczema. Let's say in a family, both the parents they have some allergy problems, then the children are also tend to have an allergy problem. Not necessarily just limited to skin allergy. It can be sinus, it can be nose allergy, eyes allergy, or even asthma. So these are all categorized under allergy disease. So this allergy do runs in family.
Is it spreadable for eczema?
Usually no. Although eczema sometimes looks a bit scary, a lot of skin rash, redness on the skin, people might be afraid to get near to them. But eczema doesn't spread from one person to another person. So it's more on the self-immune response and the immune response interacting with the allergen on the skin. So it's not an infection. If you have a wound on the skin, our body will have an immune response, go there to kill the bacteria and try to heal the wound. And sometimes the place you have a wound, when you have a higher immune activity, that can also trigger eczema. But it's not like you're getting it from other people, then you can spread it to other people. No. But sometimes people, they worry because sometimes you have a skin rash here, then they spread to other part of the body. And then they become worried, hey, will you spread to my family members? Or will you spread to my friends? But no, eczema doesn't spread from person to person.
Now we understand actually why eczema can spread from one small dot to bigger parts.
Yeah.
If it's not treated properly, right?
Yeah, a lot of people sometimes they get the eczema at the hands, and then after that they get it on the legs because it's the same immune system and the same skin.
Before we get into the real treatment of eczema, in terms of daily basis, how do we prevent this?
That's a very good question because the eczema is so common among us.
Right,
it's
very
very
common.
important to adopt a healthy skincare practice to prevent allergy. You might not have allergy at the moment, but you might have it if you don't take a good care of your skin. So the simple principle is first thing, you need to keep your skin moist to protect the barrier. Like we mentioned earlier, if your skin is dry, your skin tend to cracks, and then you will have more allergens coming into your body and create the immune response. So the first thing is keep your skin moist, protect your skin by applying a good quality moisturizer. And also second thing is having a balanced nutrition diet, because balanced nutrition like vitamins, minerals, it helps to stabilize your immune system. And sleep early is also very important. The best treatment to balance your immune system is sleep early, adequate sleep, and of course stress management. When you are stressful, you tend to have a higher immune response. So practice stress management, such as stretching exercise. Regular exercise can reduce stress. And of course, if you know you are allergic to certain medication or certain food, then you need to avoid them to protect yourself from these allergens.
So in your practice, how do you usually treat eczema when the patient comes to you?
It depends on how bad is the eczema. When they come to me, usually first thing I will see, is it a long duration eczema or is it a severe eczema? Or it's just a mild in response to certain allergens. So the treatment, usually I will need to give them some cream to restore the barrier, of course. Usually what I use is a cream contain ceramide. Ceramide is a fat within the skin. So this actually makes up most part of the skin barrier. So the first thing I usually like to give is a ceramide cream to apply to restore the skin barrier. And then I will give them a cream to reduce the inflammation. And most of the time, what the doctors will use is a steroid cream. Sometimes I don't want to use too strong medication, so I use a milder steroid first to reduce the inflammation. And of course, we always try to identify what are the trigger factors. Sometimes we know, then we ask them to avoid it. Sometimes we don't know, then we will observe and see. Then if the allergy keeps coming back, then maybe we will need to do further testing to see what is going on. First step usually is I protect the skin first. I restore the barrier using a moisturizer or ceramide cream. The second thing is to reduce the inflammation, and usually we use steroid cream. And the third one, then only we try to identify the triggers.
Oh, so it's actually the other way around. You protect the skin first.
Yeah.
Because it's like
Because if your skin
badly
is
injured.
protected, then the allergen cannot come in.
Okay.
And sometimes we are not sure what are the allergens. Sometimes it's very difficult to identify.
Right.
And sometimes there's no allergen. It's just immune response and your skin dryness, sensitivity, and sometimes just because you are stressed.
Just now you mentioned the test for allergens, right? Is there a test for eczema?
We seldom do tests for eczema, but of course there are certain tests we can do. Number one is an allergy test. Allergy test can help us to identify is there anything in the environment are consistently triggering the immune response. Okay. So this allergy test, we have 107 panels. We check 107 types of food, environmental factors, pets, and dust and pollens. Some other tests, sometimes we do blood tests to see whether their white cell is increased. Because in a severe allergy, we can see the immune cells is increased, particularly eosinophil. But sometimes we don't observe that. We don't see that in all eczema patients, so we seldom do the test. And another test we do is the inflammation marker, like C-reactive protein. People with severe eczema, because there's inflammation, then we can check this C-reactive protein to see if the inflammation marker is high. Okay. But we rarely do this test because you see the skin is inflamed. Of course, when you do the CRP, the marker is high. So we rarely do tests for eczema. The test is more like identify what is causing the eczema to keep repeating.
Right,
Or sometimes if the eczema is bad, then we want to see if there's any other reason, for example, infection or inflammation that is causing this eczema.
So how do we rebalance or strengthen the immune system? Come back to this, like most likely is the basic of protecting ourselves.
Actually, immune system is the basic, but also it's the hardest to do. Because to have a balanced immune system, lifestyle is very important. And sometimes asking a person to change their lifestyle is the most difficult part. Of course, the standard, the usually things we avoid is to sleep early and have adequate sleep, and balanced nutrition consists of vegetables and fruits. Sometimes I do give supplements to help to balance immune system. For example, the supplement I like to use is fish oil, omega-3. Omega-3 can also reduce inflammation, and vitamin D is also my favorite. High dose vitamin D. High dose vitamin D can help to rebalance the immune system, and I also often use zinc and sometimes vitamin E. But of course, the supplement is just to help on the immune balancing. The more important is still go back to the lifestyle, sleep early, stress management, and also a balanced nutrition diet.
So usually how long it takes for a patient to see improvement?
Sometimes we see result in 1 to 2 weeks time, and then after that, then we will start the maintenance to prevent it from happening again.
I'll come back to problem in treating the eczema. Any common problems that you face?
Yeah, the problem we always face is the eczema always comes back. So despite with the effective treatment, the eczema goes away in 1 to 2 weeks time. But the eczema can come back. It's probably because the skin barrier is not fully restored, or maybe the patient still having a higher immune activity because it takes time for the immune system to calm down, to rebalance itself. Or maybe they continue to expose to certain allergens which we could not identify yet. So the problem is the eczema always comes back. That's why maintenance is very important. So I always ask them continue to use a cream to keep the skin moist and to protect the skin barrier. But sometimes patients, they always not complying to the cream. They apply it for a few weeks. Oh, I got better, so they stop. Well, probably they think things coming from doctor is always has medicine, is always bad for health. So they don't like to use the cream for very long term.
What about in terms of essential oils? Can you explain any experience in this, in terms of treating eczema?
Yeah, I've heard essential oil has been a very good alternative to keep the skin moist and also to protect the skin barrier. A lot of my patients, sometimes after the treatment, so I told them to use the cream, then they don't want to use. Then I say, hey, what about you use some essential oil? This is natural, no steroid, no medicine. It's natural. Then they like it. So I've been giving to my patients your product, the Soother Balm, or they like it.
Oh, nice.
Soother Balm is also very effective in keep the skin moist, and also to repair the skin barrier and prevent eczema.
Okay, Dr. Neogh, in terms of essential oil, can you please share a bit of advantage in terms of using essential oil in treating eczema?
Yes, I particularly like essential oil because number one, essential itself is a natural product. So a patient has more acceptable in using a natural product for long term. And essential oil, because they are oil-based, oil is always better than water-based product in keeping the skin moist. It depends on the ingredient. They have this anti-inflammation property. This inflammation actually will soothe the immune system and soothe the skin, and to reduce the inflammation and the immune response. So I particularly like to use the essential oil in treating eczema, especially on the maintenance part. I've heard that you started Care Organic many years ago.
Yes.
Would you share with us how did you come to this business and what makes you start this business?
Come to my brand story is like trace back to 14 years ago. 14 years ago when I'm pregnant with my first child. So I went all in to study everything about how to be a good mom, because first time mom. It's quite shocking to find out that not just what you eat that get to baby in terms of things like absorb through skin, or
that's right.
Because skincare, right? Even cosmetics for girls, all kinds of cosmetic. There are tons of toxics in the cosmetic, and we absorb through the skin, and it gets to the baby as well. So it's quite shocking to find some harsh chemicals that even is hormone disruptors for babies, right?
Yes.
For human body also. So from then onwards, I shift everything that I use during the pregnancy time, that shift everything to natural products, and not many choices in the market that time, more than 10 years ago. So yeah, that's the starting of the journey. And when my baby was born and I get to make my first bar of soap for my girl, then it's my own mother's milk soap. And I can see that it's from my little passion born into a real thing. It's a solid thing. So it's like that soap is my passion. So I starting to dive all in, creating a series of natural products for my baby and for my family as well. And I slowly seeing that all other moms and parents, they want to have the best for their baby as well. And it's also at that time in the market, you can rarely find any natural products in the market for baby, especially baby series. So that's a huge market. I feel like I'm on a mission to address these needs for all the parents. Then there you go, the brand was born, inspired by my baby girl. That's Claire is her name.
And I also heard that recently you have got an award for your product, right?
Yeah, recently we just received recognition from ASEAN Records. So it's a huge, significant proof that, and also it's very meaningful for us. And thank you for everyone who has been supporting us.
I have been also using your product, particularly Soother Balm, in treating patients with the skin eczema. And feedback has been very good because it's a natural product and it doesn't contain harsh chemicals that can trigger eczema. So would you like to share with us more about what is Soother Balm and what makes it so special?
Soother Balm, which recently received the ASEAN Record recognitions. I'm so proud of this, my own formulations. One of my first few products that I created more than 10 years ago. First, the most special ingredients, of course, it's all plant-based and herbs. The pale pink color is from the purple gourmet herbs. So it's like no synthetic coloring, no synthetic fragrances as well. The scents naturally occur from the products is formulated from purely essential oil. Up to date, so this product is so well loved by all my customers. That's why it stands on #1, still my best sellers. What it does is the herbs formulations and the essential oil formulations, it helps to soothe your skin and reduce inflammations and reduce the skin itchiness as well.
Yeah, after I apply it actually smells nice.
The essential oil formulations that I blend myself in there, it's really soothing. So it's like the products that we created, not just for the skin, it's something when you're taking a deep breath as you use your products, it also soothes your mind and your soul as well.
So the main ingredient you mentioned was the herbs, right?
The herb, yeah.
So there's no other harsh chemicals, right?
There's no harsh chemical, 100% plant-based.
Yeah. That is very important when we come to skincare because a lot of skincare in the market, they contain this harsh soap and harsh chemical. After you use it for many times, sometimes it causes dryness and makes the skin more sensitive. Besides Soother Balm, would you recommend other product from your brand that is also very good for skincare?
We recommend natural soaps. Like our patchouli soap is one of the well-loved customers with sensitive skin. So it's very moisturizing as well as it helps to protect your skin from allergens. After you bathe dry skin, we need to keep your skin moist and also maintain the skin barriers. We have a rosehip face and body oil. It's very excellent moisturizer, locks the moisture on your skin. So it's like prevent dryness.
So this rosehip face and body oil can be used on the face as well?
Yes.
Does it cause oiliness?
It doesn't, because if your skin is very dry, so we recommend for dry skin, #1, and also we recommend to use after shower when your skin is still moist, so that is the best time to lock in the moisture, as well as to use it final step after the skincare to prevent dryness all night long.
So what is rosehip actually?
Rosehip is the extraction from the plant, it's the seeds from the fruits. Rosehip fruits. We extract the oil from the rosehip seeds, which is very rich in vitamin C and antioxidant. So it's very good for protecting your skin barrier.
Besides skincare, essential oil has also been used in aromatherapy. And we all know that aromatherapy is effective in relaxation and to improve sleep quality.
Right.
So would you like to share with us what is aromatherapy?
Aromatherapy is actually a plant extraction, particularly from plants that has medicinal and therapeutic benefits. It's like, think about Chinese herbs. We are harvesting the goodness and benefits from herbs from nature. All kinds of plants that has therapeutic benefits, use it to treat holistic treatment like skin, to improve sleep or relaxation. So these are the holistic approach. The whole treatment is called aromatherapy.
Can anyone just perform this aromatherapy? Can they just simply buy anything and start the treatment by themselves?
We recommend to consult professional aromatherapists. We go through a series of professional training and certifications that we have from the training enable us to practice aromatherapy safety and in terms of treating the right, in terms of guiding our consumers to use the proper essential oil to be functional to address their issues.
How aromatherapy can improve sleep?
In terms of relaxations, we use essential oils when we breathe in the scent molecule, when we breathe into our scent. The scent will travel through our nose, nostrils to our brain. And the little scent molecule react to our brain hippocampus center that handle our stress, handle our emotion. When the scent molecule react with your hippocampus, the aroma calm your nerves and calms your emotions that lead to good sleep.
So basically, the scent relax our brain so that we can have a good sleep.
What about, let's do a simple relaxation technique. At home, you can do this very simple relaxation technique before you sleep or any time that you feel like you want to relax. So what we recommend today is this product called Good Sleep.
Okay, good sleep. So what should I do?
Just one drop in your palm. Gently close your palm together and place it near your nose. Close your eyes and take 3 deep breathing.
Oh, it's very relaxing.
Yeah, so this is something that I always recommend to all my customers. This little simple technique, you don't need any diffuser, you just have any bottles of any essential oil that you carry with you. Anytime, anywhere, you can practice at home, before you sleep, in the office, if you rush for meeting, if you want to calm yourself down before you go on stage, any moment you can just 3 breathing. Dr. Neogh, besides treating skin condition, right, you are also very specialized in hormone therapy.
Yes.
Probably you can share a bit essential oil, how does it help in terms of treating hormone therapy?
Yeah, in my hormone therapy practice, I mostly handle women who are going through menopause transition. Menopause is a transition every woman will need to go through.
Right.
Usually the age is between 45 to 55. So as they go through the menopausal transition, they experience hormones fluctuation. The hormones is not like you have hormone, then suddenly you have no hormone. It's more like a fluctuation. And this fluctuation can take a long time to go through this fluctuation period. It can be anything within from 3 to 7 years. So when they go through this menopausal transition and they experience this fluctuation, they always have problem with the sleep and they become more anxious sometimes. Sometimes they have this mood fluctuation. So based on what you described aromatherapy, I will think it is possible useful in a complement to the hormone therapy in helping them to relax. Because when I provide hormone therapy, they use it like maybe once a day in the morning and once a day at night. But sometimes in between, during your daily routine, things can happen that can irritate you or make you anxious or make your mood slightly fluctuate. Then I would say if it would be good if they can carry the good sleep by their side. So when they are agitated or feel anxious, they can just put a drop just to help them to clear their mind and relax. And I believe certainly relaxation is very important to help them to achieve a better quality sleep. There are a lot of women when they go through this menopausal transition. One of the most important symptoms they have, and is very common, is the sleep problem. So I usually try not to use the sleeping pills. So hormone therapy helps a lot in many times, but sometimes I will also want something to help them to relax. So I think aromatherapy can be very helpful for women who is going through menopausal transition and experience some emotional swings as well as sleep problem. Besides good sleep, is there any other product from your brand that can help people, not just women, including men, or help them in relaxing or help them in sleep?
In terms of essential oil, I have a series of relaxing essential oil. This is Mood Uplift.
Oh,
Mood Uplift is also quite suitable for women who's going through menopausal transition because sometimes we get mood swings and mood fluctuates. Relaxing is something I recommend for anyone who wants to relax themselves. That's all for today. Thank you so much, Dr. Neogh, for coming with us today in sharing skin health and eczema.
Thank you, Louise, for inviting me here and also share with us the knowledge in aromatherapy and essential oil.
Thank you. See you next time.